Hello everyone, today we're diving into a crucial topic, vitamin D, particularly its significance for those over the age of 50. Now vitamin D is an essential nutrient that our bodies need to function at their best. It plays a key role in maintaining bone health, helping the body absorb and retain calcium and phosphorus, the building blocks of our bones and teeth. But it doesn't stop there. Vitamin D is also a vital player in our immune system, helping us ward off illnesses and infections. It even influences our mood and overall sense of well-being. Some studies suggest that sufficient levels of vitamin D can help fend off feelings of depression and anxiety. So, vitamin D is not just about strong bones, it's about a strong immune system, a positive mood, and overall well-being. As you can see, vitamin D plays a pivotal role in our health, making it essential for us to maintain optimal levels of this nutrient. Now, as we age, our body's ability to produce and absorb vitamin D changes, increasing our risk of deficiency. You see, our skin's ability to convert sunlight into vitamin D diminishes as we grow older. This is mainly because our skin becomes thinner and less efficient at producing this vital nutrient. Beyond that, our kidneys, which play a critical role in converting vitamin D into its active form, also tend to function less effectively with age. This means that even if we are getting enough sunlight or dietary intake, our bodies might still struggle to fully utilize the vitamin D available. And let's not forget, as we age, we may also spend less time outdoors, reducing our exposure to sunlight, which is a natural source of vitamin D. Moreover, our digestive system's ability to absorb vitamin D from the food we eat also declines over the years. This could be due to various age-related conditions or the use of certain medications that interfere with vitamin D absorption. Combine all these factors, and it becomes clear why older adults are at a higher risk of vitamin D deficiency. This deficiency could potentially lead to serious health issues like bone loss, weak muscles, and an increased risk of falls and fractures. So it's clear that as we age, our need to monitor and manage our vitamin D levels becomes even more critical. One of the most important roles of vitamin D is its contribution to bone health. So how does this work? Well, vitamin D helps regulate the amount of calcium and phosphate in our bodies, two nutrients that are essential for maintaining strong and healthy bones. Without enough vitamin D, our bodies can't absorb the necessary amount of these nutrients from the food we eat. This can lead to soft and brittle bones, a condition known as osteomalacia in adults and rickets in children. Now let's talk about osteoporosis, a condition that causes bones to become weak and brittle, so brittle that a fall or even mild stresses like bending over or coughing can cause a fracture. Osteoporosis is a common concern for individuals over 50. As we age, our bones naturally lose density, making them more prone to fractures. This is where vitamin D comes into play. Studies have shown that maintaining adequate levels of vitamin D can help preserve bone density as we age. In fact, vitamin D deficiency has been linked to an increased risk of fractures in older adults. This is because vitamin D helps our bodies absorb calcium, a key building block for our bones. So ensuring that we get enough vitamin D is crucial for bone health and for preventing conditions like osteoporosis. Keeping your vitamin D levels in check can be a powerful tool in the fight against osteoporosis. Next up, let's talk about vitamin D and its link to our immune function and chronic disease prevention. Vitamin D, often referred to as the sunshine vitamin, plays a vital role in fortifying our immune system. It does this by promoting the production of proteins that fight off bacteria and viruses. This is why you might find that you're more susceptible to colds in the winter months when sunlight, and thus our natural vitamin D production, is at its lowest. But the benefits of vitamin D extend far beyond just a robust immune system. Research has shown that a sufficient intake of this nutrient can help reduce the risk of chronic diseases including cardiovascular disease, diabetes, and certain types of cancer. In terms of heart health, vitamin D is believed to help control blood pressure and prevent artery damage, thereby reducing the risk of heart disease. In the case of diabetes, vitamin D plays a role in the regulation of insulin levels, helping to keep our blood sugar levels in check. Additionally, studies have found that people with adequate levels of vitamin D are less likely to develop certain types of cancer, particularly colon, breast, and prostate cancer. So, whether it's warding off the common cold, keeping your heart healthy, regulating your insulin levels, or potentially protecting you from certain cancers, vitamin D is an essential nutrient for overall health. Suffice to say, vitamin D is a key player in maintaining our immune system and warding off chronic diseases. Vitamin D's influence extends to our mood and cognitive health as well. It's fascinating to think that a single vitamin can have such a profound impact on how we feel and think. Let's delve a bit deeper into this. Mood disorders such as depression and anxiety have been linked to low levels of vitamin D. While the exact relationship is still being explored, it's thought that vitamin D may influence the amount of serotonin in our brain, a key hormone that stabilizes our mood. Feeling down, especially during the darker winter months, might not just be a case of the winter blues, but could be related to a lack of vitamin D. In addition to mood regulation, there's growing evidence to suggest that vitamin D might also play a role in preserving our cognitive function as we age. Studies have shown that individuals with lower levels of vitamin D may have a higher risk of developing cognitive issues, including dementia. While more research is needed to fully understand this relationship, it's clear that vitamin D has a role to play in maintaining our brain health. So, maintaining adequate vitamin D levels can also contribute to our emotional well-being and cognitive health. As we continue to uncover the many roles of this sunshine vitamin, it becomes increasingly clear that vitamin D is not just good for our bodies, but for our minds as well. Now that we understand the importance of vitamin D, let's discuss how to get enough of it. The sun is a fantastic, natural source of vitamin D. When your skin is exposed to sunlight, it produces vitamin D. However, depending on where you live, the time of year, and your lifestyle, you may not be able to get enough sunlight exposure to produce adequate levels of vitamin D. Another way to increase your intake is through your diet. Certain foods are rich in vitamin D. Fatty fish, such as salmon, mackerel, and tuna, are excellent sources. You can also find it in foods like beef liver, cheese, and egg yolks. Some mushrooms, particularly those grown under UV light, can provide you with vitamin D as well. Many foods are also fortified with vitamin D. This means that vitamin D has been added to them. You can find it in products like milk, orange juice, and cereals. Make sure you check the nutrition facts label to see if vitamin D has been added. And then there's supplementation. If you're not getting enough vitamin D from sunlight and food, a supplement may be necessary. There are two types of vitamin D supplements: D2 and D3. Vitamin D3 is the type that your body produces when your skin is exposed to sunlight and is generally recommended. Remember, it's always best to consult with a healthcare professional before starting any new supplementation regimen. To wrap up, let's summarize what we've discussed today. We've underlined the crucial role of vitamin D in our bodies, particularly for those over 50. It's key to bone health, immune function, mood regulation, and overall well-being. As we age, our ability to produce and absorb this essential vitamin decreases, increasing the risk of deficiency. Therefore, it's essential to prioritize your intake through sunlight, diet, and if necessary, supplements. So, prioritize your vitamin D intake and remember to consult with a healthcare professional for personalized guidance. Stay healthy and see you in the next video.